So basically, skin cancer in the United States is one of the most common types of cancer. 1 in 5 Americans will get skin cancer, and that has nothing to do with firefighters. One person every hour in the United States dies of melanoma. And then when we think about firefighters, that risk of skin cancer actually increases. As we know from the NIOSH study, firefighters are 9% more likely to get cancer and 14% more likely to have a higher mortality. The NIOSH study didn't talk about skin cancer, but there have been other studies that have been published, such as the Nordic study, which showed that melanoma happens in firefighters ages 30 to 49, which is much earlier than the average American who gets melanoma, which is usually a 65-year-old Caucasian male. The data that we have from the World Trade Center disaster also shows that the firefighters that arrived on scene at 9/11 have a higher rate of melanoma, and we're looking further into that data as well. So today, we're here in West Springfield to screen firefighters and to educate firefighters about skin cancer, but also to talk about the cancer risks in general for firefighters, and also to educate them about what programs are available here in Massachusetts and what programs can be used in other states if there are other firefighters that want to learn more about cancer and firefighters. I first started working with Abby in 2018. I became involved in learning about firefighters and cancer when my brother, when he was diagnosed at age 36 of esophageal cancer that was occupational cancer from his job as a Chelsea, Massachusetts firefighter, and he was also an educator at the Massachusetts Fire Academy. During that year that he was sick, I read as much as I could about firefighters and cancer. And after he passed away at age 37, I started to do skin cancer screenings using the American Academy Dermatology Spot Skin Cancer program to go out to local firefighters, and that's how Abby and I are here today. As we've built this program here in Mass, we've expanded it a little bit beyond just the skin cancer, but we've also included educating firefighters about how they can reduce their risk of occupational cancer. And one of the ways that the Mass Department of Fire Services has done this is with pairing with the National Firefighter Cancer Support Network.
So we have several instructors, about 20 instructors that go out into the communities and teach this program. And it talks about firefighters and the risk of cancer in their jobs and what they're exposed to and how they can decrease the risk of cancer.
In particularly, we have their handout, which goes over the top 10 things that they can do to lower their risk, which is available on the website. But essentially what you want to do is minimize exposure. So when you're at the scene, please, whenever it's appropriate and safe, use the wipes to wipe the soot off your skin. Please use your self-contained breathing apparatus as much as possible. Stand upwind from the fire so you reduce the amount of contaminated air that you're breathing. Please try your best to shower within the hour. So use the extractors as soon as you get back to clean your gear. And if you get another call, use your second gear. Never ever bring your gear home. Keep it in the station and keep it away from the living quarters within the station. There are some other recommendations on this list, and particularly I'm going to ask that you use sunblock when you're out and about, and you try to minimize the sun exposure that you have.
Some of the other programs that we offer at the Department of Fire Services at the Mass Fire Academy, we also offer a free CT scan. So anybody that is a Massachusetts resident that is a firefighter, over 40 years old, there's some other criteria that they need to meet, and they would be able to get a free CT scan with one of our vendors. So we also offer a free PSA blood test. You would log into our LMS and register for the PSA blood test. and you would make the appointment to go and get tested.
Additionally, we teach firefighters about the medical exam that they should get annually from their primary care providers. We have this handout here that can be accessed on our website. The Provider's Guide to Firefighter Medical Evaluations. This is an excellent handout. It basically explains your job as a firefighter to the primary care doctor in terms of your tactical athlete responsibilities at work, but also your exposures. I particularly like this handout because it's nice and concise and concrete, and it gives examples of what tests or what things should be evaluated for you. In particularly, we know from line of duty death, information from the professional union, that firefighters have an elevated risk of cancer. We know that you have an elevated risk of cardiovascular events. And so here on this handout, it talks about your cardiac health. It talks about the cancer risks. It talks about behavioral health, which is extremely important for you as a firefighter. You folks see a lot of scary stuff. You see some horrible events, car accidents. And so it's important to have a way to process these traumatic exposures that you're seeing and that you're helping the community live through. Finally, they also talk about infectious diseases, which is a no-brainer. Car accidents, you could be exposed to blood, musculoskeletal events, all the things that you know about. So we really would like you to provide this to your primary care, and hopefully soon we'll have an educational video on the Mass website that goes over why, as a primary care doctor, they need to know all this. So that could be an additional reference for your medical provider. So additionally, we'll just segue right onto my favorite topic, which would be skin, okay? So basically, there's 3 types of skin cancers that we're going to focus on today. One being melanoma, and melanoma basically, for the majority of cases, is a brown spot that is changing, a brown spot that could be bleeding, and basically what we think about is the ABCDs of melanoma. We try to make it simple. So A is for asymmetry, so it's when you have a spot that isn't symmetrical in a horizontal fashion or a vertical fashion in size, shape, or color. We also, the borders, you want to look at the borders. And so the borders, you would like them to be exact and precise. If they're fuzzy or smudgy, we don't like that. The color would be C, and that's when a spot has more than one color within it. But also if you have one freckle that's much different in color from all the rest, you would want to circle that one and show that one to your provider. D is diameter, and so basically the bigger the spot, the more chance of something going wrong. And so that's the diameter one, and probably the most important one is the E, the evolving. So this one at the bottom does not look particularly scary. The ones above, clearly there's a problem there. This one at the bottom, not so much. But you can see that there's been photographs taken of this small freckle / mole that has been changing over time. And so that's the key. Today, when you get your skin exam, we'll take a look. If we see anything like this, we're going to recommend a biopsy. Today, we might find a spot that we're not so certain, and we think that it needs to be monitored. And you can do this at home with your own cell phone. We'll take a picture of it with your cell phone. You can have a family member take a look at it in 3 months, 6 months, 9 months, year. And as long as it matches, you're fine. Then reset your calendar for another 3 months. It's not particularly difficult. Bring that photo in to your primary care. This is what it looked like on this date at this time in this photo. This is what it looks like today. Clearly there's something wrong. Let's biopsy it and be your own best advocate. If that person doesn't feel that there's much of a difference, you could always seek a second opinion.
How long are these exams?
The exams today at the station are literally 5 minutes. We take a look from your scalp to your feet. Of course, if you just wanted to have one spot looked at, we could do that too, or an above the waist. Basically, we're going to recommend that you get a full body exam. It's free, it's fast, it doesn't hurt, and you're already here anyways.
So what would a firefighter expect?
So the firefighter, if they're going to get a free skin exam through this program, you have to fill out a form. And so the form is a little cumbersome, but just do your best. You need to sign off on the waiver on the form. The top of the form asks some screening questions, which help us get the money to have these forms printed and fund this program. Your information is completely private. It stays with the screening doctor, which is me. You keep a form for your doctor in case we find something, and another form goes to the American Academy of Dermatology. So the Massachusetts Department of Fire Services receives no information on you. If I find something that I'm worried about, I will mark it on the bottom. We'll have you initial it. You, once again, will have that piece of paper so you can bring it to your doctor to be evaluated. We'll have the photo on your phone. And so it should be pretty easy for you to get follow-up. If you're having problems with getting a dermatologic follow-up, you can always contact Abby Baker. She has contacts throughout the state of dermatologists that we are trying to pair with. And also you could come and see me. That's fine too. But the goal is to have you get a primary dermatologist in your community so that way you form a long-lasting relationship and you'll be screened and cared for over time.
So what could they expect? So when they come in, what do they do? So they fill out the form.
So you fill out the form, you come into the exam room, which could be a bunk room, it could be a room with pipe and drape depending on the location. We're pretty flexible. It is a private area. I have a 5,000 lumen light that I have to look and illuminate the area. I start with your hands. I look at your hands, your arms, your chest, your belly, your legs, your feet. Then I'll swing around while you're still sitting down. I'll look at your upper back because I'm a little short. I want to get a good look. I'll look at your scalp and your face. And then I'll have you stand up and I'll look at the back of your body. I'm usually telling you about what I'm seeing as I'm examining you. You have the opportunity to ask questions as we go. And at the end, as I said, I'll mark whatever I see, mole, angioma, which are those little red spots. There are the barnacles of life that some of us form after age 30. So I'll teach about those. And if you need a biopsy, we'll chat about it and you'll initial it and we'll go from there.
Great. So what got you started doing this?
I started doing this when my brother was ill. He was a Chelsea firefighter in Massachusetts and he developed esophageal cancer, and I couldn't really help him very much, but I can help screen for melanoma.
So are there any other places that you do screenings besides the Department of Fire Services?
Yeah, so I help out with the Boston Fire Department as its own separate entity. That is the largest fire department in Massachusetts, and due to the sheer volume, we have to conduct those screenings a little differently. And we typically do those in the spring. I also help out with the professional union, and we go to their June conference and we screen firefighters within the conference venue.
So do you have any thoughts about where we're going with this program going forward?
So ultimately, we would like to get every firefighter screened for cancer at an earlier age than is happening now, both here in the state of Massachusetts, but also nationwide. We know that you're at an elevated risk of cancer, and some of the studies have shown that some of these cancers can occur in the age range of 30 to 49. We do not have perfect screening tests for every type of cancer, but we do have good screening tests for some types of cancer, such as skin cancer, PSAs for prostate cancer. In Mass, we've started doing low-dose lung CTs, which is basically a photograph at one point in time of your thyroid gland down to your stomach. And so in that one test, we can see your esophagus, the top of your stomach, your breathing tube, your lungs. We could see your thyroid gland, and also we can see the mediastinal lymph nodes, so if there was a lymphoma. This screening test is already offered to smokers in this country, so it'd be my goal to have every firefighter get a low-dose lung CT every 3 to 5 years, so that way we could track it, and if there were a small change, we could be able to detect these cancers at an earlier age. As a firefighter, you really want to pay attention to what your best feels like, and if you're noticing a change that's not if you're not rebounding as fast as you used to, if you've got a spot on your skin that's a boo-boo and it's not healing and it's been 4 weeks later. These are the type of things that we want to educate you on now, so that way you can make that phone call to your primary and say, I'm not healing well, I'm not feeling well, I'm not eating well.
Can you talk about the calcium score?
So additionally, in the state of Massachusetts, we were able to obtain a grant in which we could screen firefighters for cancer. And so we, as a team, got together and we decided that a low-dose lung CT would be the best way to screen multiple organs within a firefighter in one setting. Given that this grant was for cancer detection, we weren't able to include a calcium score. But it's the same CT scan. If you stay in the scanner for 5-10 more minutes, we can check out your cardiac calcium score. That's one more data point about your cardiac health. And by knowing that, we could potentially find a blockage in your coronary arteries and prevent a heart attack. And we know that as a firefighter, your time of around a fire, the incident of a fire, both from when the alarm goes off to when you pull back into the station, that your risk of a cardiac event is much higher. So a cardiac calcium score is one more data point that the cardiac calcium score is one more data point that can help us detect a problem with your cardiac health.
So given what happened to your brother, is there anything that you want to tell another firefighter?
I want to tell a firefighter that cancer screening is really important, and it doesn't have to be scary and it doesn't have to hurt. And if we could find these cancers early, we could really save your life. And we could help both not you, but your family at home. And so if not for you, for your loved ones, for your spouse, for your children, it can be very devastating when a loved one is lost. And I would love to prevent additional cancer losses in other firefighters.
So is that what keeps you going?
It is. What also keeps me going, the other types of skin cancers, besides melanoma, are basal cell cancer and squamous cell cancer. Squamous cell cancer, it's sort of the middle of the road cancer. It's nothing for most people to worry about in terms of, usually it's a small one and in a localized spot, we can cut it out and life goes on. These can be nondescript sometimes. Sometimes they just look like dry skin. Sometimes they can look like or feel like gritty sandpaper on your skin. You're going to want to moisturize, and if it goes away, it's just dry skin. If it doesn't go away, then get it checked out, because it could be a squamous cell, but it could be eczema, it could be psoriasis, it could be MRSA. Who knows? Get it looked at. The other thing regarding squamous cells that are important for me to mention to you is that squamous cells can sometimes occur on the ears or on the lips. And when they occur in these two areas, they can spread to the inside of the body. And we don't know why that is, but it is a known phenomenon. So if you have a history of a cold sore, or you don't have a history of cold sore ever, and you have a cold sore, what looks like a cold sore on your lip, and it's lasting more than 3, 4, 5 weeks, get it looked at, because it could be a squamous cell. Basal cells are the best type of cancer if you had to have one. This is the one that I would ask for if I had a choice. They look like zits that don't get better. Or they look like a boo-boo that just doesn't heal. So something that's a little flaky, heals up, then is flaky, then heals up, or it sometimes can look like a pimple. Get it looked at.
Do you know how many folks that you found cancer on?
It's hard to know exactly how many cancers I've found in the last 5 years that I've been doing these screenings, because these screenings are confidential. And so I only know if I found a cancer if the firefighter comes to me for a biopsy or calls me or calls Abby. I have detected at least 10 melanomas that I know about. The most severe was a stage 3 melanoma, and I'm happy to report she's back at work as a firefighter. I found a bunch of stage 1 melanomas, and so for stage 1, you get the surgery, you heal from the surgery, and you're back on the job. Stage 3 is a little bit more complicated. You typically have to go through chemo, surgery, and whatever else your specific cancer treatment would indicate. But we've had a lot of success stories.
Does it surprise you that our rate of follow-up for Massachusetts firefighters is close to 17%? What is the average for a regular person?
Yeah, and I think that that's a really good question. And so whenever you have a screening event, you can look at what the average screening numbers are. And so this screening program through the American Academy of Dermatology has been around for the last 30 years. I believe it was started in 1985. So there's a lot of data in terms of your area of the country. And so, of course, the detection of skin cancers here in Massachusetts is going to be a lot different than in like Florida. And so we've also seen that as we've traveled around the state. Certain areas of the country will have different screening flags in terms of the amount of people that were flagged for follow-up. And so I think when you look at the overall number, sometimes that can be a little, the data can get a little skewed. So definitely we have seen more than the average, but I would just preface that fact that you have to look at the numbers carefully to know exactly how much more.
So do you think it's because they're a firefighter or just because they live in Massachusetts? Maybe are they doing something else besides firefighting, do you think?
So absolutely. The work as a firefighter, we know increases the risk of skin cancers, but a lot of firefighters have a second job that could potentially put them at risk, like landscaping, construction. The other thing too is that some of these folks were lifeguards when they were younger. So all of these risk factors do accumulate. Another risk factors which some firefighters have done is use tanning beds. So when you fill out that form for the skin cancer screening, they're going to ask you what your risk factors are. So just be honest. This information doesn't go anywhere. Another important reference material for firefighters would be the NFORS tracking app. It's free. Download it on your phone. You can have control of your own exposures. That's important. God forbid you get ill 5 years from now, 10 years from now, 20 years from now, you'll have all of your exposure data, and it's all on your own phone. And so this app is free, and it will ask you, you can load what type of fire. Was it a wildfire, a house fire, an airport fire, what room in the house you were in, was there any green smoke at that fire? It's your data. You have control. You can do what you want with it. You can be as complete as you want, or you could choose not to do it. I would say 2 minutes in the engine on the way back to the station from a fire, easy breezy, but that's your choice, and now you know about it.
So I heard that there was a study that they took urine from firefighters before and after a fire. Can you talk about that?
At this point, science has evolved such that we have been able to investigate firefighters both before and after fires to look for cancer risk factors. Scientists in the United States have looked at urine and blood both before and after fires, and so we know that these chemicals are being found in the body. For instance, the dioxin level in the blood before a fire is nil, and then after a fire it's been found to be elevated, and that's a carcinogen. The polyaromatic hydrocarbons have been tested for in firefighters. Urine has been collected before a fire and after the fire, and this chemical is elevated 3 to 5 times after a fire than what it was before the fire. PFAS has also been found elevated in firefighters' bodies. So those are definite carcinogens that we are finding in firefighters. Is that the only risk of cancer in firefighters? There's probably other things that are playing a risk as well. Probably there's some thought that shift work can play a role. Sleeping is definitely playing a role. You're here, you're being woken up multiple times during the evening. That can throw off hormones. Obesity is a problem, and that's sort of a double whammy when you think about it, because it's increasing your cancer risk, but it's also increasing your cardiovascular risk. So it really is important that you folks eat healthy, try to eliminate carbs, exercise, watch what you're eating. And then finally, just living a healthy lifestyle as best you can. I know it's challenging these days. Life goes by so fast. But try to be cognizant of the choices you're making during the day. And no one's perfect. Even if you make 1% improvement in your choices every day, you'll get there.
So how would a firefighter or a department have you come into their department to do screening?
To get a free skin cancer screening, you can contact Abby Baker at the Department of Fire Services. And you can register through LMS. And by doing it this way, you'll not only get credit for the skin cancer screening, which is a point towards the free lung CT if you qualify, but also you'll gain access to all the other educational materials.
Thank you very much for having us come in and talk about skin cancer screenings and the programs that are with the Department of Fire Services. And Dr. Kannley for dedicating herself to our firefighters.
It'd be great to come and see you at your fire station. Please give Abby a call. We have a lot of fun, do some teaching, look at your skin. It's free.
All good.